26 people out of 100 in the whole world suffer from hypertension or high blood pressure. And of all the deaths that occur globally, hypertension accounts for 12.6% according to World Health Organization. Hey, you're welcome to Dr. Television, and in today's session we are going to look about the ways of preventing hypertension or high blood pressure. And before we dive into that, please remember to hit that subscription button and click on the notification bell so that you'll get all the notifications whenever we upload a video and you don't miss out anything. But what is hypertension? Hypertension or high blood pressure means that your blood is using a lot of force or pressure or energy to pass through your blood vessels. And what causes hypertension? Hypertension is caused by a lot of things, and we have a lot that risks ourselves to have this high blood pressure. We have causes or risk factors like diabetes mellitus, diseases like heart diseases, kidney diseases, and we have other things like excess alcohol consumption, excess salt in our diets, smoking cigarettes, obesity or having excess weight, gestational hypertension, or when you're pregnant, it also risks you to have hypertension. We also have causes like old age, the elderlies, 60 years and above. We also have things like stress, sedentary lifestyle, or keeping yourself in one place. You're not active, you risk yourself to have hypertension or high blood pressure. So how will these people present with? How will they feel? What do they exactly feel when they have hypertension or high blood pressure? Most of them will feel headache, they can feel chest pain, they can feel heart palpitations or rapid beating of the heart. Some can be confused, some will be dizzy, some will be anxious, and some will have numbness in their body, especially in the feet or the hands or the arms. And though in most of the cases, hypertension is asymptomatic or doesn't show any symptoms. You don't feel symptoms of hypertension like malaria. But in case someone feels the symptoms, those are the signs that they will feel. That is what they will feel in their body. Hey, we are still at Doctor's Television, and we are diving into the preventive ways of hypertension. Number one is diet. So what is diet? What do you need to eat? What don't you need to eat? In your diet, you need to minimize salt because it makes your arteries and blood vessels hard. In your diet, you need to minimize fats. You need to minimize the fats in your diet. And in your diet, you need to add a lot of vegetables so that your arteries will be strong and be able to pump that blood easily. Point number 2 is the social life, how you live your life socially. Reduce alcohol consumption. The World Health Organization recommends that for men, you don't need to take more than 2 drinks in a day. And for women, you don't need to take more than 1 drink in a single day. Please stop or minimize the cigarette smoking. Minimize the cigarette smoking. In case you are a smoker or you smoke cigarette, find ways of minimizing or reducing the cigarettes you smoke a day. And then still in the social bit of it, remember to fight stress. We are always stressed. We have a lot is happening in the world and with our lives, but try it as much as you can to develop stress management skills for you to reduce the chances of developing hypertension. And also remember to keep your body active. You can keep your body active through digging, running, swimming, dancing, going to the gym and working out. Though keeping your body active doesn't necessarily mean going to the gym. You can still be active when you're at home, in your compound or in your room, and you do those small activities or aerobics. In fact, the World Health Organization recommends at least 150 minutes per week. That is an equivalent of only 2.5 hours, meaning that you can spare at least 30 minutes of your time per day to keep your body active and have these small activities done. And our third and last point is the disease control and management. Remember, previously we said that we have some diseases that risks you to have hypertension or high blood pressure. These are diseases like diabetes, kidney diseases, heart diseases. When you have these diseases, please try as much as you can and have these diseases properly managed and controlled, because when they are controlled, they are reducing your risk of developing or having hypertension or high blood pressure. But why do we need to prevent hypertension? Yes, we need to prevent hypertension because when you have hypertension, you will have a risk of developing complications like losing your sight, like developing stroke, like having kidney diseases or kidney failure. You can have heart failure and those other many complications. And these people who are having hypertension, they always move every time and again to facilities, having the blood pressure monitored, having the drugs that manage or control their blood pressure, and it costs them financially. It also costs them their activities, because when they're going to the facilities, it means that they will not do their activities they are meant to do in their homes, because they have to do other activities in their homes. But because they need to meet their appointments with their doctors, they will have no any other option than going to go to the facility to pick their drugs and having the blood pressure monitored. And even if you don't have high blood pressure, please make sure that your blood pressure is always monitored. You can monitor your blood pressure monthly. Go to the facility once in a while and have your blood pressure taken, because when you're having high blood pressure, it can easily be detected and it is properly managed without developing any complication. Yes, we are the Doctors Television. You are Doctors Television, and remember to subscribe, hit that notification bell, like and share. Please have a healthy life, because everyone has a right to live, and the world needs your life. The world needs you healthy. So we Doctors Television, we say bye bye. We meet next time.